I work in public health. A large part of what I do is creating awareness in urban and rural communities about women's health and preventive modalities. During these open discussions at village baithaks and in villages, I always end with the statement that I will be here for the next half an hour, 45 minutes, and if anybody has anything you want to speak to me personally, I will be available. And that is when women come, one by one, very hesitantly, to talk about their health issues, something that they've been dismissing for the longest time, telling themselves it's not important. Sometimes something I said may have been relatable to them. They come to ask. And I have seen sometimes that there will be a woman waiting in the corner quietly till everybody leaves, and then she will approach very shyly to talk about her issues and her health. Very common scene in villages. And while I appreciate one needs privacy to talk about their health issues, these queries are usually very simple, something that you and I would talk about in everyday conversations. But in rural communities, they do not have words to express what they feel or what they're experiencing. They do not know how to talk about their bodies and their health. And that's probably because nobody has spoken to them about these things. They have never heard of these terms in medical or conversational language. And when you don't have words to express something, your thoughts become vague and scary. And that is when emotions like shame and stigma get attached to your thoughts. In our work, the most difficult behavior change to address is this shame and stigma around women's health. Because what you don't talk about, you don't act upon. Which is why in India, most cancer cases are diagnosed in late stage. Not because we don't have solutions, but because silence delays that moment when people seek help. About 75 to 80% patients are diagnosed in advanced stages, simply because they weren't willing to talk about it. And that is when treatment and management becomes more difficult, of course, in late stage. Now, in cervical cancer in particular, India carries the largest burden globally. We lose one woman every 8 minutes to cervical cancer. Cervical cancer is a 100% preventable disease. So think about it. By the time we finish this session, statistically, we would have lost about 40 women somewhere across this country. 40 women lost to a 100% preventable disease, right? Not because of our geography or our lifestyle or even our genetics, no. Simply because we don't talk about it. And conversations or talking about things, they address fear. They make people feel that they are not alone, right? So a lot of work that we do is in smaller towns and in villages. And when we started with this, we were told that women are not going to come. Women, what are they even going to say to their families? How are they going to come for a cervical and breast screening? So organizations that had worked before us, they told us that very bad outcomes, women don't come for screening. So we decided to flip the narrative. We sent men into the field to talk about cervical cancer. Small towns like Bathinda, Alwar, Mathura, which is a highly patriarchal society, right? Where women do not have the agency to come and get cancer screening, we sent men into the field. So about 35 to 50% of our field teams are men. And men talk to the pradhan, they talk to the village men, they talk to them about cancer, women's cancer, about how prevention is going to keep their women, it's a simple screening, is going to keep their women safe and the village safe. These are storytelling sessions, but what they do is they open the space for men to ask questions, man to man. They allow men to be vulnerable about their lack of knowledge, and they learn from there. So in the approximately 1,200 villages that we've been to, not a single pradhan has ever told us or refused us or told us not to come. Ki hum nahi karayenge, mat aao. Not once. We have screened over 72,000 women, mobilized many more for in-facility screening. We do up to 120 screenings in one day. From, women will not come, to 120 screenings a day. And all possible because of a conversation. So you have to understand that we all have a blind spot where knowledge is missing. We just don't realize it. And because we don't know what we don't know, we don't realize that a conversation could change something. So let me explain. Even women who know about cervical cancer don't talk about cervical cancer because they don't know that others don't know about cervical cancer. You get me? Only if it's an aha moment for you do you share it with others. It's like, did you know? Pata hai kya hua? That comes if it is an aha moment for you. But if it's something you already know, you tend not to share it. You don't realize that a random conversation, sharing your knowledge, not opinion, not hearsay, not a comment, but your knowledge can actually save somebody's life. Just a casual conversation. And that's how it begins. And it showed us something really powerful. This was not a breakthrough on how to talk about cervical cancer. This was a glimpse into how actually public health works. Right? Public health, a lot of people think public health is about government hospitals, ESIC and CGHS and ASHA workers, but that's not what public health is. Public health is not about hospitals. Public health is everything that prevents you from needing hospitals. Vaccines are a public health success. We don't go to hospitals with smallpox anymore. Polio we have eliminated. There's public health success stories. In fact, I think public health is a very exciting line for youngsters to consider now in your higher education. And it's an exciting time for public health. Lots of research happening around the world on public health. People think that the next breakthrough is going to be this big technology idea, right? A vaccine to prevent cancer, or a blood test that will detect all old age diseases, or a DNA test for lifestyle, something big, some fantastic idea. And that would be great, absolutely. There's research happening, that would be a fantastic breakthrough. Meanwhile, what we have, the greatest public health tool, is a conversation. A conversation that is a connection, not a Google connect, not a social media interaction, not a quick text, an actual conversation. So when was the last time you took the time to have a conversation, an in-depth, real conversation with someone? Now is the right time. Thank you.